To health matters now, cancer has been named the third leading cause of death in Kenya, with breast cancer, cervical cancer and esophageal cancer leading among the most diagnosed cancers in the country. Now, Nairobi, Nakuru, Kiambu, Machakos and Nyeri are counties with the highest cancer prevalence. According to the Status of Cancer report launched earlier today, 75 people die daily from cancer, as Bildin Waliaula reports.
The cancer burden has been on a steady growth, with mortalities recorded. In Kenya, 42,000 new cancer cases are documented annually, with 27,000 deaths caused by cancer. The most common cancers taking a toll on Kenyans are breast cancer, cervical cancer and cancer of the esophagus, followed by prostate and colon cancer. Most men are affected by prostate cancer and esophagus cancer, while the most dominant cancer among women is breast and cervical cancer. Leukemia is the leading childhood cancer, as it is always misdiagnosed as malaria or anemia, followed by brain tumors.
Notably, 9 women die every day due to cervical cancer, while 9 in every 10 persons with esophageal cancer will succumb to the disease. Currently, majority of persons diagnosed with cancer will succumb to the disease, since approximately 70% of cases are diagnosed in advanced stages when cure is almost impossible.
Besides, only 19 counties in Kenya have a health facility that can diagnose or treat cancer. Muthomi Njuki, the chairperson of the Health Committee at the Council of Governors, says counties need to pull their socks when it comes to investing in cancer care.
That we have a total of over 20 counties that have no idea and they have no space, even in their plans, on how they can be able to have their patients diagnosed with cancer unless they go to the next county or they come to Nairobi and other places. So there's a lot of work to be done.
We need to continue investing to ensure that everyone who gets cancer is identified at the earliest opportunity and treated at the earliest opportunity.
Early detection of cancer is one of the ways to stem and fight the disease. And now it's time for the national government to leverage on partnerships and invest more in infrastructure to seal the gaps available.
Second pillar is strengthening our health workforce, including community health workers. We need to train the right professionals.
That people in the communities, in the grassroots, should be able to access healthcare with some form of insurance, like universal health insurance, because that is one of the biggest gaps we have.
Cancer treatment is known to be quite costly, but now the Ministry of Health says they will be revamping the National Health Insurance Fund, NHIF, to be more inclusive.
I shall be moving it from National Health Insurance Fund to a National Social Health Insurance Fund. That for us to drive this universal health care, we have to bring everybody on board.
2 out of 3 people diagnosed with cancer will die from the disease, as 70% of the cases are diagnosed at an advanced stage. Health stakeholders are calling on more budget allocation towards cancer treatment, which is becoming a pandemic in its own way. Bildin Waliaula, KTN News, Nairobi.
The National Police Service Commission today presented its submissions on how to improve the police service. The commission, led by its chairperson, Eliud Kinothia, gave recommendations on various issues. Former Chief Justice David Maraga is leading the task force